I was a child of the 60s, so not surprising. I was very involved in the civil rights movement and also in the war on poverty. So I focused on people who kind of left out of the American dream.
In the fall of 2016, Dr. Karen Feinstein, president and CEO of the Jewish Healthcare Foundation, presented a TED Talk in front of an international audience, launching the women's health activist movement, WHAMglobal, an initiative aimed at igniting a movement around improving women's health.
I want to make things happen. I want to see permanent policy and behavioral change. I don't want to just demonstrate. I want to demonstrate how women can change society.
Inspired by her own health activist journey beginning in Boston in the 1970s, and in response to the surge of women's activism following the 2016 presidential election, Dr. Feinstein created WHAMglobal in partnership with Women of Impact, a national organization of female leaders in healthcare, to urge women everywhere to step up and fight for progress.
You can't let a movement become dormant. I decided it was time for women to show once again that we do have some muscle.
Now WHAMglobal has reached a major milestone. It is officially an independent supporting nonprofit organization of the Jewish Healthcare Foundation. WHAMglobal furthers the Foundation's long-standing agenda to improve women's health through spearheading several major public health initiatives. WHAMglobal's first focus was around inspiring women of Pittsburgh to come together and rally around a big idea in women's health.
The Big Idea Challenge was an amazing event. There were some strong ideas that really came forth. A community can really get together and bring an idea and have it become reality.
The winner of the 2017 Big Idea Challenge was the Latino Community Center for its prenatal education program for Latina immigrants. The Latino Community Center inspired WHAMglobal's first major initiative, focused around lowering rates of maternal mortality and improving birth outcomes.
I think most of us were very unaware of America's sad little secret.
The rates for maternal mortality in the United States are 3 times higher than any other developed country in the world. And this is going on at the same time that other nations are reducing their maternal deaths.
Currently, a woman dies every 2 minutes from pregnancy or childbirth-related complications globally. The leading causes of death for moms are cardiovascular disease, infection, sepsis, severe bleeding, and pregnancy-induced high blood pressure disorders. On top of this inexcusable frequency that moms are dying or having serious adverse complications from childbirth, maternal and newborn mortality costs the world economy an estimated $15 billion in lost productivity each year. As a first step in addressing maternal mortality in our region and beyond, WHAMglobal convened a panel in partnership with McGee Women's Research Institute and held a powerful conversation on the root causes of the epidemic, discussing what could be done to move the needle towards improvement. WHAMglobal has embarked on a 2-year partnership with the Allegheny Health Network Center for Inclusion Health to improve maternal health among Pittsburgh immigrant communities by implementing a doula community health worker demonstration program.
The doula comes in to reinforce and give voice to the mother, to empower her, to have her voice heard, to do the birth that she can perceive as a good birth.
WHAMglobal is building a robust policy agenda, establishing a coalition called the Pennsylvania Maternity Coalition and Action Network for Healthy Pregnancies, also known as Moms Can. Moms Can will use advocacy, research, training, quality improvement, and innovative payment models to convene key stakeholders, raise awareness of high rates of maternal mortality, develop and advocate on a policy agenda, partner with local and state governments and payers to apply best practices for perinatal care. Today, WHAMglobal is continuing to build on the momentum of the first year by launching its regional advisory group made up of female experts and advocates in women's health. But the work is just getting started.
My goal for WHAMglobal is to show that women can unite and get focused and bring about change.
WHAMglobal's mission is to empower women to advocate for their own health and that of other women. We are tired of women being relegated to bystander status in their health and healthcare decisions. We have the power to transform and create a healthcare system for us and by us.
I don't believe that the meek inherit the earth. Power isn't equally dispersed, and those who have it don't always share it. It's time. Time's up. It's time for us all as women to take back the power that we need, and we can do it together.